So you have me, Mary, your host, and my amazing co-host, Crystal.
Hi, guys.
And then we have Dr. Jayman and Dr. Jaspal with us, who are joining us from the front lines of this horrible pandemic. So first of all, thank you guys so much for joining. I can't express my gratitude in having you on the show today. So to get started, there's so much conflicting information around symptoms, right? And you know, we're here in New York City, where it's hard to not know someone who isn't affected by this. But I'm hearing so many different reports of people saying they only had like one or two of the symptoms, so they didn't take it that seriously, and then they wound up ending up with COVID and probably should have sought some kind of help sooner or would have treated themselves sooner. So can we like lay down the facts on what the symptoms really are, and if people can have COVID and not have all of these symptoms?
Sure. So I'll start, and then I'll see if Dr. Jaspal has anything to add in. So just before I can start, I am an internal medicine doctor, so I predominantly do inpatient medicine within the Northwell system, for which sidebar, our PR team has approved us doing this. And Dr. Jaspal is an infectious disease doctor. So how we pretty much work together is if I'm taking care of a patient on the floor, he's the infectious disease consultant who comes and helps with helping to decide the severity of case and the treatment options. So that's where we are right now. We were both just on service last week together, seeing really a lot of this firsthand together, which was pretty wild. As far as the symptoms go,
Dr. Anon, 3290.
Sorry, guys.
No, that's okay.
That was real.
So I actually am working from home today, but Dr. Jaspal is actually super front and center today. As far as the symptoms go, I think there's not going to be a cut and dry symptomology that we're going to be able to classify. One of the main things that people are going to be having is your cough and fever. But please keep in mind that, you know, this is happening in the middle of allergy season, right? So I think a lot of people are getting a little anxious, you know, is this my COVID cough or is this an allergy cough? But the two of the main things that we've been seeing, and I think one of our sister hospitals had looked at about 100 of their first set of patients, and overwhelmingly they were coming in with cough and fever. Some of the other smaller symptoms would be like chills, shortness of breath, sore throat, body aches, and belly symptoms. So belly pain, diarrhea. Recently, they've been putting out some information about changes or loss of smell as one of the things that are coming up as symptoms. But I don't think we can say there's a cut and dry set of symptoms that we know it's COVID. I think this is pretty much, you know, do you have a cold? Did you have the flu? Or do you have corona symptoms? So that's where, you know, some of the testing has been pretty helpful for us. Jaspal, was there anything else for symptomology?
No, you covered pretty much all of it. The only thing that's the most severe symptom is shortness of breath. People, you know, besides all the allergy symptoms, all the upper respiratory symptoms, all the coughing, fevers, shortness of breath is a serious symptom that you know, presents usually later in the stage of this illness. So shortness of breath, meaning not you ran outside and are short of breath, meaning you can't even get up from here and walk a few steps to go to the bathroom. That's the shortness of breath I'm talking about. But if you're able to walk upstairs and walk downstairs and then have to catch your breath, that's not really shortness of breath. So that's a late symptom that's usually present. And some people skip all the upper respiratory and all the fevers and go straight to the shortness of breath. So really, again, there is no way to justify or quantitate which symptoms anyone is going to get.
First. Now, I like to touch on that a little further because I have two children who have asthma. So for, you know, a mom like me, I'm petrified. And when they do have a common cold, their asthma flares up significantly. So for parents that have children that are asthmatic, what advice can you give us?
So I'll just start with that. And again, Dr. Jaspal can piggyback on it. I think one of the main things that we all have to keep in mind is really being cognizant and aware of your own body and your own symptoms, and kind of talking your children through that as well. So my kid had a sore throat the other day. So I was like, does it feel like your regular sore throat? You know, monitoring symptoms the next day, keeping in mind that a lot of people are quarantining at home with COVID. The ones who are really being admitted to the hospital are the ones who are really short of breath, requiring supplemental oxygen at varying levels. So for nervous moms with kids, which I'm one of them for sure,
Right.
I would just ask, you know, or advise that you grade what their normal shortness of breath looks like. You know, is their shortness of breath now accompanied with a sore throat, with fevers, with chills, with any other symptoms? And also keeping in mind that children are vastly affected at much lower degrees. So as a mom, I worry myself about infecting my kids, right? But I do find some comfort knowing that kids are affected much less, and their symptoms and severity of symptoms are generally much less. Jaspal?
Thank you for that.
So yeah, exactly. You know, I not really much to add to that. Children usually get a much mild COVID syndrome if they do get anything. But so far, you know, the majority of the people that are affected by this are adults, not children.
So while we're on the topic of age, you know, up until this point, everyone's been saying, oh, this is really like something to worry about for the elderly. And I mean, you know, just in seeing a lot of different posts and knowing so many people who are now impacted by it, it seems like that might not really be the case. I mean, I'm seeing, you know, again, I'm in my house, but I'm connected to the world via social media. And I'm seeing so many reports of people who are in their 20s, 30s, 40s, who, you know, are not necessarily with underlying conditions that are even succumbing to this. So is that really a myth that the elderly are the only people we should be worried about?
So I think in the front lines, we are not seeing just elderly patients. I think initially, you know, saying that elderly patients are at highest risk is absolutely true, along with patients who are immunocompromised, who are undergoing chemo, who have other medical problems. They are the highest risk patients, and those are the ones who we've been seeing getting quite affected. That being said, I believe our youngest patient in one of our sister hospitals who was intubated on life support is, I think, 21. So what I'd like to say is that, you know, I don't think we're seeing a clear cut, you know, age gap where it's only affecting this age and above. We have myself, my youngest is 30 years old, so 30, 40, 50-year-old patients who are coming in. So I don't think COVID is discriminating age. I think age is absolutely a factor in how heavily they are affected and how likely they are to be heavily affected. But I don't think, you know, age alone is something that we need to say, you know, I'm young and I'm comfortable, you know, not maintaining social distance, so I won't be affected. So that's my take on that. Dr. Jaspal.
Wow.
So you know, it's true. It affects all ages, adult ages. Again, the severity varies person to person, and you know, when what I'm seeing is it not affecting young and really healthy people.
Mm-hmm.
We can say they're young and healthy, but that's all relative. We don't know a lot of these people, how often they see doctors, how often they get blood tests, how often they get diagnosed with anything. A lot of young people are walking around feeling great and healthy, and they have other medical problems that they didn't even know they have. So, you know, it's really hard to say that this young person and healthy person is really healthy or not, unless he has been seeing doctors and he has been proven, which most young people don't see doctors. So, you know, that is kind of how you interpret it. But definitely elderly people, especially elderly people with medical problems. The major medical problems that we're seeing, unfortunately, is you know, very common in the U.S. The number one problem I'd say I see the sickest patient being is obesity.
Mm-hmm.
After that would be diabetes. Probably After that, it would be a tie between lung disease, heart disease, and kidney disease. You know, those are the people that are primarily the sickest people I'm seeing. And you know, there are young people with diabetes, undiagnosed high blood pressure, undiagnosed medical issues that we say it's a young 30-year-old with no medical problems, but I don't know what he really has until we investigate it.
And I think this brings, this sheds light, probably a different segment for you, but it really, just America in general, even young or not, just taking better care of themselves, right? Eating, drinking, hydrating, vitamins, balanced diet, exercising. So, even young people who have not maintained a healthy lifestyle, we're seeing patients who have been smokers and maybe they smoked a couple cigarettes a day for 5 years, but those are going to be ones whose lungs are not the same as someone who didn't smoke, right? So I think it's so early right now for us to really differentiate classes. But there was a 60 Minutes episode yesterday where some of the Northwell physicians were on there, and they were definitely classifying that they're seeing more patients who are obese, not doing so well. And it's the same risk stratification as Dr. Jaspal just mentioned.
Wow. This is all really interesting. So how can we really try to prevent catching this virus in the first place? I mean, we've been getting drilled into us, washing hands is really important and integral, but some people feel like they've been washing their hands and they're still getting it. So how is this really spread, and what can we really do?
So Dr. Jaspal?
So spread is, a great question, and something that we, are consciously doing now. Unconsciously, people have not been doing this, but, we are conscious of washing our hands, and that's a big player of preventing this virus, of course. Washing your hands with soap and water is probably the most important part. Purell and alcohol-based stuff is good. It's not 100% effective, but it is technically you're washing your hands. So the mainstay of transmission that we know of is actually respiratory droplets. The reason they're telling you to social distance, they canceled all these basketball games, the seasons of these games, concerts, all these things, is to stop the person sitting next to you from giving you the virus, because you're less than 6 feet away from each other. Just being less than 6 feet away from each other and talking and just talking next to each other, there's respiratory droplets that you don't even know are being shedded from your mouth when you talk. And those respiratory droplets can travel up to, some people say 4 feet, some people say 2 feet. Let's just say 6 feet for the best case. So you're literally less than 2 feet from the person sitting next to you, or maybe let's say 4 feet. You're still transmitting the virus. That's transmission. Other thing is, you're talking, the table in front of you, respiratory droplets can come on the table and you don't even see it. It's clean, but this is someone touches it, got enough virus on their hand, that's transmission. So we tell you clean surfaces, watch what you touch. If you do touch other things, after doing that, go wash your hands with soap and water. Don't touch your face. Don't touch any mucosal surface on your body. That's where this transmission is happening. Don't rub your eyes. That's a mucosal surface. Mouth. Those are all mucosal surfaces. This virus gets into the angiotensin converting enzyme 2 receptors. Those receptors are in your lung and in your GI tract. So there have been reports of this virus being found in fecal matter. Is there proven that fecal matter is a way to transmit? Not entirely, but it's a theory out there. And so be hygienic, wash your hands. Doorknobs are probably big factor to transmitting this. So every once in a while in your house, maybe twice a day, wipe down the doorknobs. Before doing anything to yourself, wash your hands with soap and water. Those are probably the best things. You going out to the supermarket, you're putting yourself out at risk because you're going to be walking the aisles with people in the aisles. Stay away 6 feet. Try to stay 6 feet away from people. You could be literally passing by and someone coughs 4 feet away from you. You don't know what's in the air in that area, and a lot of people, especially young people, they found under the age of 25, teenagers and age of 25, they have no symptoms at all, and they have the virus, and they're able to shed a lot of this virus out. And these are the people that are out there affecting a lot of people without even knowing it, but because they feel healthy and they feel fine. But the transmission is there.
That's a great point. And I know a lot of friends of mine, even, they're saying, I'm not in contact with anybody. I'm going to the store, or, I'll be right back. And, even with my husband, he's like, well, I'm going in the elevator. I'm not touching the buttons. But, can it be that it stays in the air for a certain amount of time, doctors, where if, let's say, somebody sneezes and, okay, they're not 4 feet, you're not in the same vicinity as them, but let's say they came out of the elevator and you walk into that, that's how severe or easily it could be transmitted, right? Just for those people who are saying, but I'm not in contact with anybody. They don't know.
Respiratory droplets usually don't stay in the air that long. Usually it's less, depending on the amount of respiratory droplets coming out. It's usually a low time period. Anywhere from probably less than an hour.
Okay. Less than an hour?
But yes, but there's two different types of droplets, right? There's airborne droplets, which are different, which can stay in the air longer and can be, and usually when you are sneezing, coughing really hard and producing these virus particles coming out, a lot of those are airborne, and those airborne particles are able to go further than 6 feet, are able to stay in the air for a longer period of time, could be even hours. And technically that stuff should not be happening outside, because that person should be so sick enough that he should not be going outside or going anywhere that he should be coming in contact with other people. But I would say stay away from the outside if you're not feeling that good. Even if you're coughing, the whole city is on lockdown. The country should be on lockdown. This is how it was controlled in other parts of the world. If you're not feeling well, why are you out there? Why are you putting other people at risk to even spread this virus further than what it's already at? So it's one thing that you can do as a human being is that if you're not feeling good, if you even have a cough or even an upper respiratory infection, stay inside. There's no reason to go outside unless something emergent that you have to do. But yeah, these droplets can stay in the air for quite some time, and the only way to really prevent them from being there is not being out there at all.
And I think, Mary, what you alluded to before about having different pieces of information, us as healthcare providers are also getting different pieces of information. And I think the key is that because this is a fairly new thing that's happening, we're still learning about timeframes, sizes, best safety measures, which is why we're really enforcing just to stay home and just be hygienic about, washing your hands and just be hygienic overall, but don't go outside unless you need to go outside.
Wow. So treatments, right? Like, are there really any treatments that are proven to actually work, or is everything still touch and go? I mean, that's the impression I'm getting. Everyone's glorifying this Zithromax and hydro blah blah. I can't even pronounce it.
Hydroxychloroquine.
there you go. That's why you're the doctor, and not me. But yeah, so it's like, first of all, I feel like who's really showing up at the hospital in dire straits and saying, give me the Zithromax and hydroxychloroquine? Like, it's weird because I'm seeing all this stuff passing around on social media, and it's like, this is what, now I'm having a moment, a young moment, get out. But yeah, so it's like, I feel like sometimes I'm probably like, it's probably annoying to you guys as doctors that people are passing this around and then people are showing up feeling like they're armed with info. And it's like, you know, the doctors kind of know best. I mean, at least that's the approach I take. So, but I feel like people are sharing that as if that's like a life-saving bit of information that doctors wouldn't already know anyway. So does that really work? Is that something that's proven?
So I don't think there's anything that has been 100% proven at this time, keeping in mind, again, that this is fairly all new to everyone and they're just trying treatment options that they think would work just on a pathophysiological standpoint. But as far as studies, we're kind of leaning on other countries who've been there, done that already to have some guidance. But I don't think it's a swear-all medication where, you know, you have to get this medication right now. Dr. Jaspal?
So I'm giving this medication to people. Am I seeing results? I'm not sure. Some people get better without the pills, and some people don't get better with the pills and still get worse.
Dr. Mark Spaginski, 3.
So, you know, these pills they're based on studies of like 20 people and say, oh, they worked on these 20 people. What about the rest of the people? I'm not sure. I'm not seeing great results with them. I think it's kind of overhyped that this stuff works. Maybe it does work. It might work at a certain time, meaning just like Tamiflu for influenza, you have to take it within the first 48 hours of symptoms. Is it the same case? Is it a different case? I'm not sure. We don't have the answers for that because there's no really controlled trials or studies on this. The study we're going by is a study that was done on 20 people that got these pills and apparently got better. Did those 20 people get better by themselves? Even they didn't need the pills? Could be. I don't know. But you know, it's not really. Personally, I'm not seeing very favorable results with these medications.
And also keeping in mind, also keeping in mind when we're getting, you know, younger or older patients and they're rapidly decompensating, and this is an option that we have, yes, with a study of 10 or 20 people, yeah, we are using it together in the hospital and kind of just crossing our fingers and hoping they get better. But I don't think at this point there's a lot of uncertainty right now. And it's really tough as providers to you know, give anyone that glimmer of hope with all the uncertainties that are out there, except that we just go on what 1 or 2 studies we have, and we're still learning. A lot of institutions are starting studies now, or have been in the last couple of weeks, and are still in that ongoing phase where we're trying to see what's helpful and what's not. So these recommendations, although they may be coming out, they're changing on a daily, if not weekly basis.
Right. So for those of us who are, you know, home and we're being very careful and we do find ourselves having a few symptoms, are there any, you know, natural remedies or vitamins that you as, you know, doctors recommend for us to boost our immune system so that, you know, we can maybe hit it before it hits us hard? Or what do you recommend?
So I think if anyone's having symptoms and they're concerned, the next best thing to do, and this is only understanding that, you know, most of healthcare is just inundated with patients right now. I think the next best thing to do is just contact your doctor, your regular primary care doctor, who will then be able to refer you to the appropriate place where you may be able to get testing, or they can say, hey, your symptoms are so mild right now. Yes, it could be, maybe it is, maybe it's not, but do X, Y, and Z for now. And with the surge in testing, you know, on a system level, what we're really trying to do is, even if you have classic symptoms, you know, that we think is COVID, you may not necessarily need to get tested right now unless there's increasingly severe symptoms, because we're trying to keep some of our testing for patients who are in the hospital. So even, if I walk into a testing site now and I say I'm not feeling well, they're not just going to go ahead and test me, right? So really it's to communicate that with your primary care doctor and see if they can help you distinguish symptoms, severity, and site for testing if needed. As far as building up your immune system, this has nothing to do with the current pandemic. Just building your immune system from a medical standpoint for any patient is really taking your multivitamin. There's some people saying to increase your vitamin C, but really to do the things that we all should be doing from a baseline standpoint. Getting enough rest, at least 7 hours of sleep, maintain hydration, adequate hydration, drink lots of water, healthy diet, right? Staying away from people who may have some symptoms. And really back to that is just the vitamin support for your body, because it increases your antioxidants and your ability to fight things off. So really, again, things that we all should be doing, whether there is a pandemic or not, is really concentrating on just taking care of yourself in those aspects.
Thank you, doctor. That's important.
So as much as you can describe, right, I'm very curious about what the situation is like, the atmosphere in the hospitals right now. I mean, it's really being portrayed to all of us in the media that it's like hectic and, you guys are running out of PPE, sorry. I'm like getting all of my medical terms confused today. So like, is that really the case? Are you guys scared, or is it under control, but like you're more scared of what's to come?
As far as the control, so keeping in mind that we are in the pandemic phase right now. So we're in this phase where, have we reached the top of the curve? Have we not? We don't know, but we are just seeing an influx of patients coming in. It's a higher influx of patients in the ICU. Recently on that, a little bit over 20% of the patients coming into the hospital are getting intubated. They are being put on life support. And this in itself is scary, right? So as a healthcare provider, I'm petrified of getting it and not doing well with it, and having severity of symptoms and spreading it to my kids, right? So my husband's in a similar field, so we are both petrified. So I think we all go into work with a little bit of fear. And then when you see the floors they're scary, right? Family members are not allowed for overall safety purposes, which are absolutely within reason. And everyone's just scared to get it, right? So whether you're in the hospital or not, there's a baseline fear. So I was just on service this last week. Dr. Jaspal was there. It's gloomy. It's gloomy. We don't know which way patients are going to go. We have some idea of patients who are going to inevitably crash. But because there's such a huge amount of uncertainty in this pandemic already, it's just a gloomy nature from the uncertainties, I think, right? So notoriously, physicians are a type A people who know X, Y, and Z, 1 + 1 = 2. And there's so much uncertainty right now for us. So the floors are gloomy. Patients don't have family members with them. Patients are scared because there's so much information out there. It's just sad. It's very sad, and people who are dying from this are not, can't have family members with them all the time, right? So we are trying to arrange when family members can come in a way that's safe, not only for staff, but also for those family members. So in an inpatient setting, the majority of the patients we are seeing are sick, and it's just very gloomy. It's very gloomy, right? I think a lot of physicians are inevitably going to have some PTSD after this pandemic is over.
That was actually going to be my next question. Like, if you feel like we're going to be traumatized, or, like if there is going to be some PTSD among healthcare workers being exposed to like these conditions. So, I mean, I have a friend that lives across the street from Elmhurst Hospital, which clearly is being described as the epicenter. And she, is saying that she's getting anxiety from just hearing the ambulance go out every second and seeing lines wrapped around for the emergency room, which in my mind, I'm like, well, how sick is everyone if they can wait on a line? But that's a whole other story for another day. So, I mean, I feel like even people who are just witnessing this that aren't working in it are probably traumatized as well. I mean,
I mean, absolutely. I think there's so much out there, and I think this is a good time for people to pick a reliable source where they're getting their information from, because I think there's so much information out there that in itself is making people anxious. And when you turn on the news, everything is all about COVID. So that has a lot to do with it. So I think the general public in itself, and don't forget, we're all getting cabin fever, right? Everyone's indoors. We're indoors with kids, homeschooling and trying to work. So there's already a generalized anxiety from that. So I think the general public is going to have a significant amount of anxiety from this, but I do think healthcare workers themselves are going to have some degree of PTSD from this. It's really tough. It's tough to sit there and talk to patients, and say, whatever we say, and then leave them, and there's no one there, right? And do all patients have cell phones? Do they have the ability to turn on their hospital phone? Do they have the money to turn on their television? Like, these are all things we so take for granted. That it's getting sadder and sadder as healthcare providers to see this.
It's terrible. It's very bad.
And we are FaceTiming. We're all working. One thing I will say from my hospital is we're all working together so well. We're FaceTiming family members, but then you come across a family member who doesn't have a phone, right? Or their phone's not FaceTime compatible, or they're coming with a flip phone that you can't FaceTime. And so they're going out in the community looking for a FaceTime phone. And then now you're trying amidst one patient to try to get another patient a FaceTime call. And it's a lot, right? So we're not just functioning as physicians there. We're, triaging conversations, trying to take care of our patients' mental health as well. It's tough.
If one thing you can take away from watching this show is that if you're not sick, don't come out. Stay inside. It's really bad. What you see in TV is sugar coated compared to what we really see.
That scares me.
So it's not good.
And we don't mean for it to be be scary, but we think that generally there's a large group of people who are underestimating it.
Right.
Yeah,
People they don't think they're real.
A lot of people don't think this is real. A lot of people think that this is just not surreal, fake, made denial. I'm not sure what they were in, but yeah, you're absolutely right. A lot of healthcare workers are going to have PTSD, or what I call it right now. People are having TSD. Can't be posted if it's not done yet. But yeah, it's traumatic for a lot of healthcare workers, and as time goes on, I think healthcare workers are just people, but they get really thick skin, and it's unfortunate that they become thick skinned, but that's what I see happening.
Yeah. Do you find that some of them are even scared to stay a long time in the room with the patient and provide them comfort, like they're just in and out?
So healthcare workers are very not selfish people. Let's just say that. They will go and run and do things to save their patient, and put their life at risk. The biggest problem we have is that we do that, and if we're not careful enough, we're going to put ourselves at risk and get ourselves sick. And like you've seen on the news, doctor gets sick, whatever, in the hospital with blah blah blah. But that's also a big. Like Razia said, she fears for her life. You fear for your life every day, but sometimes when stuff goes wrong, you don't think about your life anymore. You just go do what's the right thing to do.
We thank you every second of the day.
That was so deep. Yeah. Well, so I was going to ask what your biggest concern or fear is as healthcare workers right now, but I mean, I think you just summed it up, Dr. Jaspal. Yeah. It's like, and we worry for you guys with that as well. I mean, it's like how you just described how it is transmitted, and you are literally like coming into contact with multiple patients, and I just can't imagine your strength. So honestly, and I think I heard somewhere that today is National Doctors Day.
It is. So, it is National Doctors Day.
So we owe you a thank you and
Yeah.
all of that good stuff
Thank you.
for that. So last question. I know I took a lot of your time, probably more than we planned for. But I don't know if you have kids, Dr. Jaspal, but Razia, like as a mom, as a yum, how do you feel like going out into the front lines of this every day, and how has your life changed?
Dr. Jaspal actually has 2 kids. I think he has a fairly brand new one too.
Oh no. Well, yes, but no.
I have an 11-month-old and a 4-year-old.
Oh my God, congrats.
Thank you.
Wow, congrats, but that must be doubly scary, I'm imagining.
Oh, yeah.
So
Oh, yeah.
please, let us know.
So there's a whole protocol I have to follow, which my wife has, pretty much outlined. How do I come into the house?
Right.
And pretty much, I mean, the clothes I'm wearing in the hospital, I change before I go home in the hospital. And then when I get home, I change those clothes again and take a shower before I even see anybody. So it's a very elaborate process for me to get into the house.
And just so you guys know, we've all actually been going to Dr. Jaspal to find out what his process is, because we're copying his process. So my husband is a pulmonologist, and he's out there intubating a lot of these patients on a daily basis. So, both of us being healthcare providers, we have an 11 and a 6-year-old, and my little sister is staying here with me to help watch the kids. A lot of kind of mind-numbing things went into deciding where the kids should go. Can they go to my parents? Well, what if they're asymptomatic carriers and they'll get my parents sick? So really articulating who should be home with the kids and who's willing to put themselves at risk, right? So we have 1 or 2 family members who are, volunteering to put themselves at risk for us, because we can very well bring it home to them, and how will they react? We don't know. So there's a huge process for me, Mary, as well. When I walk into the house, I disinfect everything, clean the doorknobs, go right in the shower, wash my hair every day. So there's all these posts about people becoming obese after, having to stay home for COVID. I'm going to be bald because I'm washing my hair every single day when I come in the house. And then I disinfect my car. I have a set of clothes that stay in the car. I don't bring any bags or anything with me to work. I haven't cuddled with my kids in like 2 weeks. We're also maintaining social distance, which is very tough to describe to a 6-year-old, and not only for yourself, but also for dad. So, you can't cuddle with either parent. We're not kissing them. We're not sharing utensils. We're really maintaining social distance with them. So on top of being at work and being scared and fearful, you're coming home and having to, re-explain who, what, where, when, why to your kids. So it's been really tough. And that's why, when I see these posts on Facebook about how media is, hyping it up and it's not that bad, it's really frustrating, because it is that bad. And we just all need to collectively do our part and just stay home. And if you need to go out, do it in as smart of a manner as possible with your hand sanitizers and your Clorox wipes. And, humans touch their face most amount of times in a day, right? So your face and your mouth, and we are, no matter how much hand washing we're doing, if we touch a surface and scratch our eye, it's like, so just be smart and safe about your actions. And one of the things that, when the kids got out of school and they're homeschooling, is all these moms wanting to do play dates. I'm like, no play dates, like social
virtual
distance.
Zoom. That's it.
Yeah, Zoom it over there. But it's been tough. It's been tough being a healthcare worker who's a mom with a spouse who's also in healthcare. The kids I worry about them also, being, traumatized by this. My son comes in my bed at 3:00 in the morning. So having to turn him away every morning is really tough, right? He goes and cries in his room, and it's tough. It's tough. We do Friday night movie nights and we can't cuddle with the kids, So, and I'm sure it's the same for Dr. Jaspal.
Well, thank you guys so much. We know you probably have to run off and save lives. So we appreciate you. And by the way, Dr. Jaspal's wife seems like she's the real MVP for coming up with that system. You might need to write that down. But yeah, thank you. You guys are honestly the real MVPs here for us and for the country. And we appreciate you and applaud you. And we hope you know how much you're appreciated. So thank you again. Can't say it enough.
Yeah. Thank you for being so real. Thank you so much for sharing your story, each of you. I appreciate it.